Hi everybody, it's Dr. Newman. I want to talk a little bit about insurances and breast reduction. Frequently when patients are coming in for breast reduction conversations, those conversations many times will talk about whether or not their insurance will pay for breast reduction. Many patients come in and want their breasts reduced simply for cosmetic reasons, but many patients also come in complaining about neck pain and back pain and shoulder pain, rashes underneath their breasts, other issues that are related to the fact that their breasts are large that really are medical problems that the insurance company is there to help you pay for your medical issues. So the insurance company needs to be convinced that this is a medical problem that you have. You're going to want to know what you've done to try to treat this medical problem other than coming to a plastic surgeon. For your neck pain, your back pain, and shoulder pain, they'll want to know if you've seen a physical therapist or a chiropractor, or are you taking medication to help with your neck pain and back pain? Those types of things become important. They'll also want to know, well, how much tissue are we going to reduce your breasts by? Logically, if I take off just a small amount of breast tissue, that's probably not going to help with neck pain and back pain. So the insurance company has some cutoff to decide, okay, this is cosmetic, but if you take off enough, well, maybe this is something that's enough to actually help with your neck pain and back pain. The insurance company used to use a very straightforward cutoff for that, and that was a 500-gram cutoff. If I remove 500 grams, a little bit more than a pound from each breast, and that satisfied their requirement. But now they take into account your height, your weight, which makes a lot more sense, but they want to know how much we're removing, and that needs to be above a certain guideline that your insurance company will require. We use something called a Schnur scale, which looks at your height and your weight, and there's a chart that you can look up and see kind of the guideline that most insurance companies now use. There'll be a link below this video that links to a part of my website that shows the Schnur scale and can help you look up and calculate what your requirement would be based upon your height and your weight and give you an idea of whether you would qualify for insurance coverage.